Hi everyone, hope you're doing well today. My name is Victoria Locklear and I'm a UNCP nursing student. Today we will be discussing the impact of smoking in older adults. My goal for this presentation, after you guys view my presentation, I would like for you to be able to understand how smoking affects the elderly population, risk factors with smoking in the elderly, and why the elderly smoke, how perceptive they are to quitting, and important therapies to help the elderly quit smoking. I was able to get my information from the National Institute of Health and the CDC. So let's begin. Here are some facts about smoking in the elderly population. Did you know cigarette smoking is the leading cause of preventable disease and death in the U.S., accounting for more than 480 deaths every year, or about 1 in 5 deaths? Older people are the highest percentage of people who smoke, according to the CDC. These statistics include about 18% of all people between 45 and 64, which is the highest age group, and around 9% of people between 65 and up. Among the elderly, current cigarette smoking was highest among persons who were divorced, separated, or widowed, and lowest among those who were married or living with a partner. Smoking leads to disease and disability and harms nearly every organ of the body. Older adults who had experienced serious psychological distress were more likely to be current smokers than adults who did not report serious psychological distress. One study from the CDC found that 70% of all deaths related to smoking happened to people over 60. Some ugly risk factors of smoking in older adults. It is estimated that there are 4.4 million U.S. smokers ages 65 and older, and 8.4 of seniors smoke cigarettes on a regular basis. Smoking damages nearly every organ in the body and causes diseases such as cardiovascular disease, high blood pressure, stroke, aneurysm, dementia, osteoporosis, eye diseases, diabetes, lung cancer, and respiratory diseases such as COPD. Although cardiovascular disease is the most common cause of excess mortality among smokers, lung cancer is the largest cause of excess smoking in older adults. So here we're going to walk to my board, and I just did a board on the different types here of smoking. So smoking in older adults, we all know there's many kinds, and here is emphysema, right here. Emphysema is a chronic obstructive lung disease characterized by alveolar damage change. So if you look at my pictures here, this is what a regular lung looks like, and this is what a smoker's lung looks like, especially in the elderly, right here. The alveoli is very close. And here is a picture of all the chemicals that cigarettes contain. They contain over 7,000 chemicals. Alrighty. And over here, we have our healthy lung versus our smoker's lung. And as you can see, the smoker's lung is very black here. It's very black because non-particles of carbon black in cigarette smoke trigger inflammation in the lung. It is common knowledge that a black pigmented material is in the cigarette smoke, which stains the lung. So it comes from the carbon monoxide from the cigarette. Alrighty. Move back over here. Okay, so what do tobacco products contain? As we just talked about, cigarette smoke contains more than 7,000 chemicals, at least 69 of which are known to cause cancer. Nicotine is a powerful drug. It is one of the most toxic of all drugs, comparable to cyanide. Take enough of it and it can kill you. Did you know when you smoke, your heart beats faster, veins constrict, your blood pressure increases, adrenal glands pump out adrenaline, smooth muscles relax, metabolic rate increases, and electrical activity in the brain changes? So just imagine how potent or toxic this drug is to an elderly person's body. So that's what we're going to discuss. What smoking does to an elderly person's body. It can cause them to have dry skin and wrinkles because, as we all know, smoking can dry out your skin and make it less elastic. It can cause you to have thick, dark mucus, as we just saw in the picture. It can cause you to have erectile dysfunction in men, less muscle, and smoking also causes an overall weakening to your immune system due to the high potency of chemicals and sludge in the inner workings of your body. This makes it more difficult for your body to heal when you have an infection. Alrighty. So why do the elderly population smoke? So I was able to conduct a survey on 3 elderly people in the Robeson County area who were present smokers or past smokers. I asked them a series of questions, and at the end, they told me 2 reasons why they smoke. From the survey, these were the most common reasons why the elderly client smoked. 1, it helps them to relax and decrease feelings of distress. 2, helps them keep their weight down. 3, increases their energy level. And 4, helps them concentrate. How receptive are older adults to the idea of quitting smoking? Older smokers are less likely than younger smokers to attempt quitting, but they are more likely to be successful in the attempts that they do make to quit. Older adults continue tobacco use at a high rate, have less awareness of potential harmful effects, and may be more resistant to quit tobacco use because they have smoked for so long. The good news is, no matter how long you have smoked, quitting improves seniors' health immediately when they stop. Upon quitting, smoking begins immediately. Within 20 minutes of quitting, your blood pressure and pulse rates begin to drop to normal, and your body temperature increases to normal. Within 24 hours, the chance of a heart attack begins to decrease. Within 48 hours, food will begin to taste and smell better. Within 72 hours, your bronchial tubes relax and breathing becomes easier, and your lung capacity increases. After 2 weeks, your overall lung function increases. After a couple of months, your breathing still is continuing to improve, and you also have a less chance of having a heart attack. After 1 year, your chance of developing coronary artery disease is half that of a smoker's chance. After 3 to 5 years, your risk of dying of a heart attack returns to that of a non-smoker. And after 10 years, your chance of developing lung cancer decreases to that of a non-smoker. Therapies to help the elderly quit smoking. Quitting smoking for good often requires multiple attempts, especially in the elderly. However, it is possible to quit. When developing your plan, ask yourself, what type of program is best for you? What method of quitting is best for you? And do you want to use medications to boost your efforts? So some therapies are the reward system. When you don't smoke a cigarette, reward yourself. Try new physical activities you enjoy, such as walking in the park. There are also several medications that you can be put on to help you aid in quitting smoking, such as the nicotine patches or Chantix. You can also do individual counseling and phone counseling. You can call a smoking quitting line in your state. And also there's a mobile app you can download. It's called Smoke Free 60 Plus, which is for an app for the elderly. So check this out. It's really a good app. All in all, I want you to remember this. Tobacco use among the elderly is an important and potentially preventable health problem. Smoking among the elderly increases the chance for many chronic diseases, with the most common being cardiovascular diseases, respiratory diseases, stroke, and cancers. Tobacco products contain many harmful ingredients, and it can be very deadly to your body. The elderly are less receptive to quit smoking, but are more likely to be successful in attempts to quit. There are a lot of therapies and treatments that can be put in place to aid in helping you to stop smoking. Always remember, it is never too late to quit smoking, no matter your age. Remember, guys, if you are still trying, you have not failed. You can quit smoking. Stick with it.